Sensationally silver, because you are.
Welcome, everyone, to Sensationally Silver, A State of Mind, conversations with extraordinary, ordinary persons of age, people who are going to bring you information, inspiration, and validation. Join us. Hello, everyone, and welcome to Sensationally Silver, A State of Mind, conversations with extraordinary, ordinary persons of age. My guests today are Steph Campbell and Susan Johnston, and they're going to be sharing with us some things that we need to know about medical aid and dying. This can be a controversial topic, and so we're going to give you both sides, but these lovely ladies have a certain commitment to this whole thing, and you're going to find out about that as we talk. So welcome, Steph, and welcome, Susan. I'm so glad you've joined us today.
Thank you for having us. Yes, we're so grateful to be here because our mission with Compassion and Choices, we're both volunteers. Our mission is to help citizens of California, but we're concerned about the citizens across the whole country having access to the legal option to obtain medical aid in dying when they are faced with a terminal illness. So we want to honor the End of Life Option Act in California. That's the law that we helped pass in 2015.
And is that in law in most of the states in this country or not?
No, it is in 18 states in the District of Columbia. And other states have activism going on where they are trying to make this a law. And I think that it's probably, they probably have groups in every state
who are kind of pushing for this.
Who are pushing for this law, yes.
Yes, okay. So let's talk about why not. Why is there resistance? Why did people have to activate to get this looked at and considered and passed as a right?
So I think that we can say that the resistance comes in two parts. One part is doctors feel that their mission is to do no harm and to save people's lives. And they will do that no matter the pain that causes the individual, because they feel that that is their mission. So that is one aspect of it. And the other aspect that is probably more prevalent is the religious aspect, where conservative religious groups feel that one should live as long as one can, and God decides when the end of life should occur. And I can tell you from my experience, because I have a husband who used medical aid in dying, and once you know that the end of life is approaching, there seems to be a real question as to what the value is to extend that. And that was certainly his view. He had dealt with a father who died of cancer in a very bad way. And I had dealt with similar issues with both of my parents. And we did not understand why doctors could not do what was necessary to bring it to an end when they knew that the end was, days away, weeks away, and there was no value for extending it.
So doctors, of course, in their training are not trained to release people from their bodies at the end when there's no hope of recovery. Everything is about saving that life, as you said. But it occurs to me that we have measures that we take now medically that didn't used to be options. So sometimes life can be extended and extended and extended when this is my phrasing, people might object to the idea, nobody's home in that body. I mean, I know that's one of the things that happens is that person isn't there anymore. And yet the physical body is producing a lot of pain and a lot of suffering. So there's options on both ends. There's options for prolonging life, but sometimes you're prolonging agony, right?
I think what the mission, absolutely. I think the mission of Compassion and Choices as a nonprofit national organization is to empower people to have control and choice over their end of life decisions. And the law in California, as in the other states, is very strict about the criteria for being able to use medical aid in dying, so that one cannot just say, I'm tired of living. Like, you have to have a terminal diagnosis and, well, be 18 and be a resident of the state that you're in. But the criteria and the safeguards preclude it being used in a manner that would not be, help me with the word, ethical and appropriate. So the criteria help us. I know that some citizens are troubled by the fact that if someone has dementia, they do not qualify, because you have to be of sound judgment to be able to ask the physician for help and the prescription to use medical aid in dying.
So at this point, no one else can make that decision, no matter what shape the person is in. It has to be the person's own choice. And what I think I'm hearing is it needs not to be a choice of kind of voluntary suicide. I just want out. I don't want to do this anymore. There have to be factors present that make the continuation of life. It's not going to go on and on and on. All that's left is more time suffering. Am I hearing that right?
That is absolutely correct. And the physician has to say that the length that you have left is 6 months or less. And if you don't meet that criteria, you're not eligible for it, in addition to being 18 and being of sound mind. And the sound mind is very important, because no one can ask a physician to do this for you. You have to be able to make the request to the doctor, and without any interference from anyone else.
Nobody pressuring anybody. And
correct.
Tell me this, because I have no idea. What about an individual doctor who isn't willing to go along with this? Does that happen?
That happens, and that is perfectly acceptable. If a doctor decides that they do not want to participate, the patient is, of course, eligible to go to another doctor who will help them with this. But no physician and no pharmacist and no nurse is required to participate in this.
So nobody has to violate their own value systems.
Correct.
They can take their stand, and the person who's considering this option can look elsewhere to get.
And that's written into the law, that no facility, no individual medical professional is forced to do anything. So that's why we do encourage people to search for a supportive hospice. And by supportive hospice, we mean that they would allow a staff member to be present, and that they would allow their resident physician, to prescribe also. So there are supportive hospices and those that are not. So we encourage people.
So I would just like to interject here, yes, that there may be people working within a hospice, right, who are not supportive, and they do, even if the hospice is considered supportive, their personnel do not have to participate if they do not want to. So let me tell you a little bit about my husband's story. And he had cancer and was diagnosed with 6 months or less to live. And we found a supportive hospice And when they came out to visit with him, the very first thing he said was, I want to use medical aid in dying. He had made that decision way early on that that was the way that he wanted to end his life. And when he met with the physician who was at our house, I left the room. I didn't want anyone to think that I was pressuring him, participating in this decision, that this was his choice. And that worked out very well for us. And the hospice was incredibly supportive. And one of the things that we found here in California is that there are hospitals that are religiously based, and they will not allow their physicians to participate in this effort. And our physician, although he personally was in favor of it, he could not, as a physician that was affiliated with this one hospital, do anything about that. And we found this hospice, and their doctor became his primary doctor, and he was the one who wrote the prescription and did all the work to make it happen. And that, I think, is common. And that's why we tell people you need to look for a good hospice that will support you.
Is one of the factors, though, even though you as a spouse or someone else as a family member or whatever is not allowed to put pressure on the patient, is that other person's suffering often a factor in the decision to seek this medical aid?
I think it's the primary decision that they.
I think she means the family member suffering is a decision. Is that what you mean?
Right. That's what I'm asking.
No, it is not. This is the patient and the physician make this decision totally on their own.
I understand that. But what I'm asking is for the patient, is the family members suffering because of their suffering? I mean, I know that often when someone is suffering, the family members actually suffer more than the person does. I remember when I was in graduate school and a woman was talking about her daughter, and her daughter was very, very ill. And her daughter said to her, Mom, you're suffering a lot more than I am. So that's my question. Does that create pressure on the patient to go along with leaving the body?
Well, I think that it certainly can. I think that the physicians who interview them make an evaluation as to the role of the family members and the patient and how that is impacted. I don't think it's possible for you to be the primary caregiver of someone who is dying and not be completely involved with it.
Of course, yeah.
There is a fair amount of data they found in the surveys of family members that you were speaking of, who experience a great deal of, I want to use the word relief, but that's
relief is the correct word.
Yeah.
Yes.
That they helped their loved one and supported them in this very challenging time. And that the grief that they experience is lessened by the fact that they were able to help their loved one with their choice and end the suffering, which is interesting because they can think back to that support that they gave and know that they were helping in a very difficult time. So
giving a gift to this person they love.
It was a gift.
A gift of freedom from that
and
suffering.
Steph gave her husband a tremendous gift. So,
well, that makes sense. And certainly with the history, Steph, in your husband's family, watching his father struggle and be in pain and suffer and suffer and suffer. These kinds of things make huge impacts on the way we deal with life stresses. You know, if we emerge into something wonderful after going through all kinds of stress, it's one thing. But if that tunnel is only leading to a more difficult place, that's another story. So when we already know that would be a big.
Yeah, I think that is very true. And I think one of the things that was an issue for my husband was he had seen his father have surgery that was not successful and then go through chemo that was also not successful. And even though it was many, many years ago and things have changed and all of that, he still did not want to do those things because of the huge impact that his father's death had made upon him.
That makes so much sense. So, Susan, what got you involved with this?
So my mother, who would not have been a candidate for medical aid and dying, lived to be 103, but she was anticipating a difficult death and made me promise that I would help. And I said, okay. And I was very naive and I had no idea what that meant. And so that got me started in investigating. And then I found Compassionate Choices and the incredible work they were doing. And so that's my kind of origin story. And then Steph and I were working to have the law passed in California in 2015 when Governor Brown was the governor. And our regional director asked if we would work together as co-team leaders for Orange County, California. And so that's how we were connected. Yeah, so she my mom lived to be 103 and still wouldn't have qualified because she didn't have a terminal diagnosis. But I think I appreciate that she was thinking ahead. She was doing exactly what Compassionate Choices want people to do, which is to empower themselves about the end of life decisions. And the website has lovely, lovely resources. They have a dementia toolkit to help families think it through, even though they might not qualify for the law to use the End of Life Option Act. There are still some tools they can use on the website that helps their family understand what choices they want as they progress in their illness. So it's a very rich website with a lot of resources. And what we both appreciate is that in California, the title of the law is the End of Life Option Act. It's an option. It's one of 5 different end of life options that people have. And that's why we're always we're no longer curious or surprised by the opposition, but it's always interesting how people want to dictate to others who are suffering what their choice should or should not be. I personally have a very difficult time with that, especially since no one's forcing anybody to do anything they don't want to do.
I want to tell a little story that's a little off track, but very relevant. I have a very good friend, and she and her mother, who was very old, were taking a stroll in the Montecito Cemetery, which is a beautiful place. It's beautiful. And so they're taking this walk. They have beautiful paths and all that. And her mother had the kind of walker that you can sit in when you get tired. You can sit down and then you can use it to move forward. So her mother said, I'm feeling a little tired. And she sat down. And after just a few moments, her head just went to the side. She was gone. She was gone. Yeah. And so my friend called whoever she needed to call. Her she never fell out of the chair or anything. She just sat there. And the emergency people all showed up and they all wanted to do everything they were trained to do to resuscitate this woman. And thank God, my friend had on her phone her mother's directions: do not resuscitate. And she was being given a bit of a hard time, like she didn't care about her mother and all this. And 2 of the chief people, police and fire, showed up. And one of them said to all these people who were trying in their own way to help, he said, leave this woman alone. She's just lost her mother. And recognized that this was this person's choice. So there are a lot of ways of being prepared. And that one worked out. I mean, there's an irony to passing away in a cemetery. There's something about that that's kind of funny. but it's so adorable. It was such a beautiful exit. She just left.
That's
She was
amazing.
so lucky.
Yes, yes, I would agree. So lucky that she left so peacefully and that her daughter was able to follow her wishes, which were right there to look at if you were the person, wearing the cape and running to save this person's life. She didn't want it saved. She was very tired of living, actually. She felt like she'd lived plenty of time. She was ready to go. So, yeah.
When we do outreach workshops to help people understand how to access and navigate the law, we really encourage people to make a video on their phone and of their wishes to use medical aid in dying or not, or whatever their choices are, and send it to the whole family so that everybody understands that they're in charge of their own end of life decision making. And people have said it really, really helped to do that, because sometimes in a family you will have siblings and children who don't feel the same way or don't feel supportive. And so this way, legally, they cannot intervene in the sense that their loved one has made it clear. And now we have the technology to support making your wishes known to your whole family. So.
It occurs to me because the other night I was in a meeting and I was sitting next to someone who had a watch on, and on it there was a metal attachment that identified her as a diabetic and gave necessary information for anyone who needed to help her. And I remember thinking, because I knew we were going to do this podcast, is that something that's ever available to people in case the daughter's not there with the phone, to wear something that says, don't resuscitate? Does that happen?
I believe that does. You can get these little things that clip on that say DNR on it so that people know that. I think that, the tendency is we want to save everyone, and without really paying attention to what that person wants.
And not knowing the whole picture.
Correct.
And what you were saying, Susan, about how it could become a really painful and so upsetting debate amongst siblings, children of this person. Oh my gosh. So that avoids that. This is my decision, and here's what it is. You guys don't have to figure it out. You don't have to decide for me. I'm deciding. That takes a lot of pressure off of everybody, pro and con, doesn't it?
Yes, and I did have a friend whose father was failing and was in the hospital, and they wanted to do, as you mentioned, everything possible to save him. And that was not his choice. And he had completed what we call the POLST form in California, Physician's Orders for Life-Sustaining Treatment. It's a bright pink form, and one filled it out with their physician and both sign it. And I said to her, she called me from the hospital and she said they want to give him a feeding tube. And I said, well, does he have a pulse? And she said, yes, but it's at home. And I said, well, you need to go home and get it. So she raced home, brought it back, and then they honored the wishes on the POLST. So that is also a resource on Compassion and Choices website, I believe. If you type in the search bar POLST, POLST, that everyone and every state has their own acronym for it. That we should all be very aware of that as an option, and as we get more fragile and vulnerable, complete one and carry it with us. That would be helpful too.
That makes a lot of sense, because even when you're talking about someone's physician, a lot of us don't really have a physician. We're part of some sort of networky thing that who knows who we're going to see. And that person may not be familiar with our ideas about what we want. So to have it as available as possible, if this is something that we want for ourselves, that's on us, right? That's our burden to make sure that that communication is there. Okay, any other stories that you have about just how this has helped, how it's been avoided and caused pain, whatever you have?
I think people report their stories as across ethnicities in California have all been, at least at the 70%, 80% level, very supportive of it. And I don't have another personal story except that when we were trying to get the law passed, I volunteered to be an editor of the stories that would be sent to our legislators, and they were all heartbreaking, the suffering and the need for the law to be passed. And these stories, as you say, how important they are, these are the stories that helped our California legislators. And I know there's stories, New York just passed their law. Every state had their own citizen stories that convinced the legislators that this degree of suffering was inhumane. And for those who wanted the option of medical aid in dying, it should at least be there for their choice to use.
I know when AIDS was causing so much suffering and was just a terminal diagnosis, that it became known that people were eased out of their body toward the end, often more pain medication than they needed just to get them free of that. And at the same time, anybody who helped with that
Right.
was committing a felony and could have been incarcerated for maybe the rest of their life.
Yeah.
So the risk of what felt like a very loving commitment to this person's welfare could cost so much, could carry a very high price. And that's what this legislation avoids. When someone wants that other choice, it saves those other loved ones from having the burden of making a decision that endangers their own freedom and their own life.
You know, our California law was given impetus by Brittany Menard. I don't know if you remember her. She was on the cover of People magazine where she had a brain tumor and it was causing headaches and seizures. And it was.
And she was very young.
Yeah.
Too.
She had just gotten married, right?
She had just gotten married.
Her husband is now an advocate for across the country. He's amazing. But she had to move her whole family to Oregon, where the law was first established. And it became their mission as a couple during her remaining time that other people wouldn't have to upend their whole life to have the option to end their suffering. And her suffering was, she waited till the very, very end.
Yes, she did.
And she endured all kinds of pain, wanting to stay with her own loved ones. And then finally, she was able to use the law in Oregon. And we really want to emphasize that the word suicide is sometimes in the media is used incorrectly in association with our law, where they will say physicians assisted suicide, or well, they're committing suicide. And the law specifically states that it is not suicide. What is killing somebody is the disease. And that is what is put on the death certificate. So on Richard's death certificate, it said cancer, not medical aid in dying. And the distinction we really need to make is that when someone commits suicide is because they no longer want to live for either psychological reasons or whatever. But the people who use medical aid in dying would like to keep living if they could, if the suffering wasn't so intense. So we really ask people to use the correct language because words have impact and influence. And I just didn't want to forget to mention that.
Well, and isn't suicide often not covered by life insurance? And it's considered a criminal offense.
Right. And
so I'm assuming that this somehow bypasses that.
It does. It protects all the legal agreements and signatures one has made. It actually states that in California law, that it does not affect any benefits for the family. any
insurance or anything else that they may have
right.
is not impacted. Whereas if you commit suicide, normally there is they don't have to pay out because it's been a suicide. So that was specifically put into the law, and I think that people really appreciate that fact.
Well, and I hear exactly what you're saying, Susan, that word carries a very onerous implication. And this is much more about a free choice that isn't made because of psychological distress that maybe could turn around as much as a physical progression toward an end that's going to involve a lot of suffering along the way.
Right.
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 And we talked about how physicians have a choice whether to support a patient's request. And we do encourage patients, if they have a response from a physician where they say, I can't help you with this, that they contact Compassion Choices. There's a number on the website, right?
Correct.
And they will guide them as to next steps. And there in California, there is a wonderful association called California End of Life Choices, or End of Life Choices California.org. And they have a phone number, and they actually will guide patients to resources where there are physicians who are supportive. For the other states, I don't know what their equivalent organization is, but it's important that patients don't get discouraged if their initial requests are turned down.
So you mentioned 5 choices. Can you delineate what those 5 choices are?
Yeah, I'm just going to look at my notes so I don't forget. There's the refusal of treatment to discontinue the treatment that's been prescribed is one option. To voluntarily stop eating and drinking. The acronym is VSED, VSED. And on our website, there is wonderful information about how to voluntarily stop eating and drinking if someone doesn't qualify for medical aid in dying. But that usually requires medical supervision to make patients safe and comfortable. Right.
It doesn't require
Not
it,
require,
but
right.
it recommends it.
Thank you.
Because it's something that's very difficult to do on your own.
And then there's the possibility of a patient electing it's called continuous deep sedation to manage pain. And that is where the patient enters a coma state in the hospital. That is, and again, we speak of families, and that's rife with all kinds of anxiety and stress, but that is an end of life option. And then the medical aid in dying is the last one on our list, because we don't want people to think that we are proposing that as the first choice, but it is a choice.
Okay. Well, a lot to think about. And what I'm really getting is this is something that people should be looking at any point in their life, because that decision is one that's so important. If you feel like you want to avail yourself of this kind of choice, it's worth lining up the steps ahead of time, well ahead of time if possible. And again, relieving the family of that burden. I want to thank you both so much, Steph and Susan.
Thank you so much. We're very grateful.
Yeah, well, you're very brave, because I know there's a fight here that you probably have to engage in way more than you want to. And, this program isn't telling you this is what to do. It's saying this is an option. And that's what these lovely ladies are saying. If this is your choice, here's how to make that choice. Make it legally and with forethought. And yeah, I like choices. I'm in favor of choices. So thank you again, both of you. And thank you to all of you who have joined us today. Pretty serious stuff, but that's what we do here on Sensationally Silver. We're not kids anymore. And these are issues that need to be part of our consideration. So we'll see you next time. Bye. Great news, everybody. Our premier hair care product line, Sensationally Silver, is now available on Amazon. You can order it so easily, you can get it so quickly, and you can be so sensationally silver.
Sensationally silver, because you are.